Hello, my name is Higon. I'm Saise Humble TV. Aji Dimapur Hospitals laga doctors kan Dimapur laga Chief Medical Officer Dr. Moatam Jin Jamir pra lead kurigina ekta press conference loishe CMO office te. CMO bra koshe press conference matia laga main motive to hospitals kan nichor ge justify kuriya na holibi manuke accuse kuribole matia nai. Ajikali manu bishibi social media misuse kuriya se aro hospital laga kisa kan palbra nachanigina misa khobor fila bishi dikipaya se gushe. Itu nimide taikan COVID-19 laga hospital protocols kan manukan ge palbra chanai dibule mon ase inika hoile public kan COVID-19 laga hospital protocols kan bi palbra chanibo aro blindly news kan bisas na kuribo. CIHSR laga director Dr. Sedevi bra koishe manubishi bi kisa kan palbra nachanigina social media de halitia aro itu bra public kan hospital kan ge trust no kuri chai kundu bishi harmful aro dangerous ase. Taikan bra social media chula manu Zion Hospital aro CIHSR laga patient duijon laga kisa palbra nachanigina social media de digina hospital ke defame kuriya laga bi address kurishe. Dr. Sedevi bra koishe CIHSR bra YouTuber action laga khilaf court case file kurigina ase. Taikan idu laga incident de Hornbill TV ke handouts bi dishe. Zion Hospital laga doctors kan manu bra taikan ke defame kuriya laga incident de kotha kurishe. IB idu laga details sabo.
Against this, the first post, we have filed a court case. So the concerned YouTuber will have to go to court and they'll have to answer. We'll also go to court, we'll also present our case and let the court decide. Huh?
There is a lot of misconception about a patient who died recently, schizophrenia of this 38-year female from referral hospital. This patient, I will tell you about the detail. First, she was referred from Terran and to gynecological department because she is pregnant for 6 months. But after gynecological department, they saw her, there was nothing wrong with her, with the gynae. So she sent it to me that she is having breathing problem and continuous cough. Because of that, it could be some other disease. It could be cardiac disease also, like that. She sent it to me. She came in a wheelchair in my room. I saw her, and when I saw her, she was very, very sick. Her breathing was around 40 to 50 per minute. Normally it is less than 30, but her breathing is around 40 to 50 per minute. And not only that, her heart rate is also around 130. Normally it is less than 100. And when I check her oxygen saturation, it was 70%. Normal for you and me, it is 98 and above. And second thing is, she was coughing continuously when I saw her. She cannot lie down also, even for a minute. But in spite of that, since we are suspecting of cardiac disease also, I tell her to lie down on the bed, and we did an echocardiography also. That shows normal. And since she could not lie down, we did an ECG also. That was done on wheelchair. Normally we do it while lie down position. After seeing all this, then I sent her for X-ray. X-ray was showing typical of COVID. And this is the X-ray you all can see, which you can see here, bilateral, both sides, not in the center, but in the periphery side, there is a lesion. So these are presently with the pandemic situation, typical of COVID, you can say. So after this, I said, most probably this will be COVID. So we'll go for COVID. Like that, I told them. I didn't tell the patient because the patient was very sick. I sent her to the emergency department for oxygen therapy. And within 15 minutes, the results were available. And after that, since it is positive, the report is here, red positive. As Siddhi has already highlighted, after red, you are not supposed to do anything because it's positive means positive. So it is positive. Then I told them to go to referral hospital since we are not allowed to keep COVID patient at the moment. So that is the case. But there is an allegation that we're making COVID positive. Like that, it has come. So I don't know from where it comes, but this is the fact I'm telling.
Hi, there has been some news going on in social media about the Sting Zion Hospital patient who expired in a hospital who was COVID-19 positive, and they were talking about why, if the patient was positive, why the body was not prepared. So I just want to start from the beginning. I was a doctor on night duty when the patient came to the emergency department. He is a patient with some comorbidities, and he's already been treated in different hospitals. And when he came with a discharge summary referred to higher standards. So when he came, I examined the patient, and the patient was already very serious. He was already severely wasted. He was in shock. He was gasping. So after I examined the patient, I explained the prognosis. I said, like, how the patient is, what the how his vitals are, the prognosis, whether his condition is good or not. So I explained everything. He was breathing. His breathing was really bad, gasping, and then his blood pressure was low. I couldn't feel his pulse. Heart sound was very feeble. So after checking this, I shift him to the emergency ward inside, and then I started him on oxygen and all the necessary medicine which he needs at that moment. And then for any admission, especially in ICU admission, we need TrueNAT. So when I asked permission that for the patient to be admitted, he needs to do COVID-19 TrueNAT. The patient party replied that they have already done rapid antigen test from another hospital just 2 or 3 days back. So I had to explain to the patient that the difference between RAT and RT-PCR, the CB-NAT, TrueNAT. So after they agreed, we took the sample from the nose, and then it was sent to the lab. The lab people took it for testing. So while waiting for that, the patient's condition deteriorated, and after around 6:35, I think, the patient stopped breathing. So after making sure that his heart rate has stopped, after checking everything vitals, if nothing is functional, I declared and told the patient party that the patient has sadly passed away. So after giving the death summary, I got a call from the lab saying that the report has come. And then that when I sent someone, the ward boy, to pick it up, and then it was weekly positive. So I had to tell the news to the patient party. So I called aside the brother and the sister, and I told them about this thing, but they were a little bit suspicious, saying that, why only now you're giving us the report? So anyway, I told them about this thing. Since he's a positive cases, we have to prepare the body bag. But they answered that since this thing, they're planning to take him home and wash him and clean him. But I said, this is a pandemic time, COVID-19. It's risk to not only to an individual, but the whole community. So you discuss with the family members, and I went to the thing to see other patients. So now, while we're waiting for all the arrangement, our ward boy went there, and then they had a little argument about the whole thing being the false, whether the report was false or yes, and all, and so on. And after that, again, our staff nurse, she went and spoke to the patient brother, and then he said, please wait. Third time, again, our same nurse went and asked for the preparation of the body, but the patient brother refused. So ultimately, we had to send the body home without any preparation as the guidelines, or follow the guidelines of the SOB. So that's all I want to say. It's because we didn't prepare the body, because the patient party or the patient's brother refused to do so.
Press conference day, Dr. Spishi bi daikan laga frustration bi janai dishe. Ekta fane daikan bishi duk paigina manuge treat kuriya se nichor laga life thar de rakhigina aru dusra side de manukan kisa khan palbra na janigina hospital ge defame kuriya laga bishi dikhi paya se gushe. Idu homoi Dr. Ekchun bra manukan iniga hospital khan ge defame kuriya dia khan laga against ki action lobo koigina hudishe. CMO bra koishe government Taikan laga side bra eku kuria nohoi idu mamla de hoilibi Taikan DC logo de likhigina taige manukhange hosa nahwa kisa khan social media de dibule restraining order dibule mangibo koise doctors kan bishibi goise Taikan gunbi covid treatment nohoilibi covid test kurigina poisa kamobule koshish kuria nohoi aru publican idu palbra chanibule lage goise Dimapur laga CMO conference pra Dimapur de COVID-19 laga updates kan dishe. August 31st day 922 COVID tests Korea de 56 notun COVID case record kurishe. No tune recovered hoishe aru total active case etia du 357 ase Dimapur de.